Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Ketogenic diet may protect against prenatal stress. Study finds, break and number 148, a high-fat, low-carbohydrate ketogenic keto diet may help protect young animals from the lasting effects of stress experienced before birth. New research suggests. Break the findings, presented Sunday at the European College of Neuropsychopharmacology, ECNP, conference in Amsterdam, at growing evidence that diet could play a powerful role in shaping brain health. Break studies in animals often yield different results in people, however. Break researchers at the University of Milan found that when young rats were fed a ketogenic diet soon after weaning, they were less likely to show behavioral problems linked to prenatal stress such as social and mood disorders. Break in the study, pregnant rats were exposed to stress during the final week before giving birth. Their offspring were divided into two groups, one fed a normal diet and the other fed a ketogenic diet. Break by day 42, half of the rats born to stressed mothers and fed a regular diet had social and emotional problems. In comparison, only 22% of male rats and 12% of female rats fed a ketogenic diet developed these problems. Break the diet seems to have acted like a shield for their developing brains, so preventing social and motivational problems from ever taking root. Lead researcher Alessia Marchesine, a doctoral student at the University of Milan, said in a news release. Marchesine noted that the protective effect appeared to work differently by sex, reducing inflammation in males and boosting antioxidant defenses in females. The study also found that the rats on the ketogenic diet grew more slowly, suggesting that calorie restriction could play a role in the mental health benefits seen. If these findings translate to humans, we may be able to treat the long-term burden of prenatal trauma simply by adjusting what AT and number 145, risk kids eat, Marchesine said. Anniko Carosi, an associate professor at the University of Amsterdam who was not involved speak in the study, said the research contributes to the growing field of nutritional psychiatry, which explores how food impacts mental health. The presented study interestingly shows that prenatal stress-induced risk to altered behavior can be modulated with a ketogenic diet fed after weaning. It will be intriguing to further explore what are the biological processes involved in these beneficial effects and if such effects are sex-specific, Carosi said. Sources: European College of Neuropsychopharmacology, news release, October 11, 2025. Disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. and Copy, 2025 Health Day. All rights reserved. Ad as a preferred source on Google. Read this next: 700 plus CDC layoffs reversed amid backlash over cuts to disease response teams. And number 148, layoff notices to some 740 workers at the U.S. Centers for Disease Control and Prevention, CDC, have been rescinded. While personnel leading the Joe Biden begins treatment for aggressive prostate cancer. And number 148, former President Joe Biden is now receiving radiation and hormone therapy to treat an aggressive form of prostate cancer, his office confirmed. What's your zip code? It could matter to your newborn's health. And number 148, an expecting mother's zip code can influence the future health of their newborn child, new research has found. Women with rural zip codes are. More news resources: to MedWatch, Drug Alerts Daily, Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.